In this video, we will explore OET reading, a walk through the hospital. Welcome to the hospital, but not as a patient and definitely not as a staff on duty. Today, this entire building is secretly designed to teach you OET reading. We are going to walk through three major zones of the hospital, and each zone will mirror one part of the OET reading exam. This is not a lecture, this is a guided experience. Take a deep breath. Let's begin. First, let's move on to the emergency department. First one is the emergency department, the world of speed, scanning, and immediate decisions. Doors swing open, the ED is buzzing, nurses move quickly, monitors beep, stretchers slide. This is not a place for long thinking. This is not a place for slow reading. This is where you can scan, decide, and move. That's why reading part A belongs here. The ED mindset. Imagine you are senior clinician walking in. Four patients are lying in four beds. You don't examine deeply. You simply check, right? Who has which problem, who needs what belongs where. This is exactly what Part A demands. You will face four short texts, each with a purpose, and your task is simply to know where does this piece of information come from. No deep thinking, no reasoning, no interpretation. This zone of the hospital trains your mind for instant recognition. Okay? So, step one, quick scan. When a doctor enters the ED, no one reads every detail. They skim the monitor, glance at the chart, looks at vital signs. That is exactly how your eyes should behave in part A. You're not reading to understand, you're reading to locate. Okay? And here is the step two. You have to identify the nature of each text. In the ED, one bed is trauma, one is cardiac, one is pediatric, one is respiratory. You mentally tag them. In part A, you tag the four texts as well. Okay, so this text is about causes. This one is about treatment. This one is about risk. This one is about definitions. Got it? You have to mentally tag each portion. And step three, you have to trust the speed because ED is built on speed, not speed for carelessness, speed for accuracy. In part A, your goal is not to understand everything. Your goal is to spot the answer quickly without reading the whole world. Okay? Now, let me give you the key skill of part A. So, part A is not testing reading. Remember that. It is testing your ability to locate information fast the way health professionals do every day. Patient chart, scan. Drug details, scan. Allergy list, scan. Reason notes, scan. If you read slowly in Part A, you are behaving like a first year student. But OET expects you to behave like a professional. And professionals don't waste time. You walk out of the ED and turn toward the elevators. Your speed is trained, your scanning skills are awake. Now let's go to a calmer section of the hospital where clarity and understanding matter. So we are entering the nurse station zone 2. Here, reading for purpose, procedure, and workplace clarity. Here, imagine a bright nurse station with charts, folders, whiteboards, protocols pinned on walls. This is the heartbeat of hospital communication. And this is exactly what reading Part B mirrors, right? So, Part B is made of short workplace text, not complicated research, not long essays, but the kind of writing that keeps hospitals safe and organized. So when a nurse picks up a memo or a protocol, they don't stare at every word. They immediately identify three things. First thing, what is this text trying to do? Second one, who is it talking to? And the third one, what action does it expect? So these three questions are the backbone of reading part B. Remember that. Now let me tell you the three hospital secrets of part B. First one is Purpose drives everything. When a hospital release a text, it always has a purpose, right? Inform or warn or guide or update or remind or instruct or restrict. So when you understand the purpose, you instantly understand the text. Got it? So first thing is you have to understand the purpose. The second one, tone reveals intention. Even formal hospital writing has a tone. And that tone tells you how serious or strict or flexible or urgent the message is. Even formal hospital writing has a tone. And that tone tells you how serious or strict or flexible or urgent the message is. Words like must, ensure, required, then it means the tone is strict. If you can see words like where appropriate, if possible, then it's flexible. And words like encouraged, recommended, then it's a soft guidance. Words like immediately, with caution, it states the urgency, right? So reading part B expects you to feel this tone. And the third secret is details are not the main idea. Part B is not about tiny details, it's about the overall purpose and the message. For example, in a busy hospital, staff don't memorize every detail of a protocol, right? They understand what it wants them to do. That skill is exactly what OET checks. Now, you finish walking through the nurse station, and now we enter the deepest, most intellectual part of the hospital, the place where thoughts, opinions, doubts, and interpretations live. Yes, the consultant's meeting room. Here, now imagine that we are opening into a conference room, senior doctors sit around a long table, research articles scattered, professionals discuss the results. Okay, so this is reading part C, the consultant zone. Here, nothing is spoon fed, nothing is obvious. This part is not checking whether you can read, it checks who you are as a thinker. So when specialists read research, they don't simply collect facts. They interpret, they question, they evaluate. In part C, you must read like a specialist. What is the writer trying to say? How confident is the writer? What feeling or attitude does the writer show? What is implied but not stated? What contrast or shift is happening? What does the writer really mean? This is the art of deep reading. Okay? Now, remember there are four invisible skills of Part C. Yes, it's invisible, but you need to understand this. The first skill is understand attitude. When a consultant says the results are interesting, they don't mean interesting like a movie. In medical language, interesting may mean surprising, uncertain, or we need more evidence. So, learning to interpret tone is the core skill. So, you have to understand the attitude. And the second skill is try to discover meaning behind words. No researchers writes everything directly, right? They hide their real meaning between the lines. Words like although, despite, however, continues to, suggest, indicates, remains unclear, widely debated. So these words are clues to the writer's real thoughts. Try to identify that. And the third skill is track the movement of ideas. In Part C, the writer's opinion may shift from negative to positive, from confident to cautious, from uncertain to optimistic. So you must follow the movement, like tracking a patient's condition over time. And the fourth one is avoid literal interpretation. Part C is never literal. The correct answer is rarely a sentence copied from the text. In this room, you are not reading words. You are reading the writer's mind. That is the true purpose of Part C. Okay? Okay, now let's see an example here. And before that, remember that we have completed the hospital walkthrough. You now know the secret structure of OET reading, part A, which is emergency department, speed, scanning, locating, and part B, the nurse station. Remember the purpose, instruction, workplace clarity, And part C is a consultant room. Inference, attitude, and interpretation applies here. So this is not a formula. This is a shift in thinking. When you read each part through the lens of the hospital, you don't just answer questions. You read exactly the way healthcare professionals are expected to read. Okay? So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.